Mr. President, today the Senate's taking a second step to deal with the public health crisis that's destroying lives and damaging communities across the nation, the epidemic of opioid and heroin abuse. Step one, late last year, was to reduce spending in other programs and increase dollars available to deal with this addiction. An estimated 1.9 million American adults have an opioid use addiction or disorder related to prescription drug pain relievers. Another 586,000 have an opioid use disorder related to heroin. 2.5 million Americans are dealing with this problem. Our nation's veterans, Mr. President, are particularly at risk for developing a dependency on opioids. A study published in 2014 found a high prevalence of chronic pain among veterans because of their service. The chronic pain among veterans was 44% compared to 26% in the general public, and a higher prevalence of opioid use at 15.1% in the U.S. military after a combat deployment, after possible injuries in training, injuries from an IED attack, compared to just 4% in the general public. In 2014, more than 1,000 Missourians died from an opioid overdose. In St. Louis alone, deaths related to opioid abuse have increased nearly 3 times since 2007. Member after member have come to the floor, just as they came to me last year as the chairman of the Funding Committee for Health and Human Services, and explained what a problem this is in their state. The majority leader made a point to me the other day that in Kentucky, more people died last year from drug overdose than died from car accidents. According to the Centers for Disease Control and Prevention, 44 people every day die from an overdose of opioid pain relievers. 78 people die every day from a combination of a pain reliever overdose or heroin overdose, and many times those prescription opioids have been the pathway to heroin. Deaths from prescription opioids have quadrupled in the past 14 years. These are stunning statistics. The Center for Disease Control has rightly labeled this an epidemic. This should get a good vote on the Senate floor today or tomorrow, but just because it gets a good vote doesn't mean it wasn't an important debate to have. Just because it gets a good vote and is now better funded than it's been in the past doesn't mean that the Senate and the House don't need to weigh in and say, here's more specific ability to deal with these problems in new ways. The good news is that addiction is a treatable disease. Those who receive treatment can recover and go on to lead full, healthy, and productive lives. In Missouri, 72% of the individuals who had gone through our state's opioid treatment program in random test drug-free. The problem with addiction is that only about 10% of individuals that are battling addiction, drug addiction, receive treatment. That's why I'm proud to be a co-sponsor of this bill. That's why it's important that we commit ourselves to win the fight against addiction, and we need to make sure that all the stakeholders are involved. First responders, if you are a first responder attached to a fire department, for instance, the odds are that you're going to respond to 3 times as many drug overdoses as you do to fires. So whether it's first responders, paramedics, the law enforcement community, we need to use all of our resources to try to be sure that we're doing what needs to be done here. The Comprehensive Addiction and Recovery Act that we're debating provides grants from multiple government agencies to encourage state and local communities to pursue strategies that we know work The only thing you have to do is be sure and implement those strategies. The bill expands the educational efforts to understand addiction as a chronic illness that promotes treatment and recovery and prevents opioid abuse from going forward. The bill also expands resources to identify and treat the incarcerated population suffering from addiction disorders with evidence-based treatment. Finally, it expands disposal sites for unwanted prescription medications to keep them out of the hands of children and adolescents. Way too many unused painkillers are still in people's medicine cabinets or their dresser drawer waiting for somebody else to find them, and once they know they're there, to find them again. This bill represents a strong bipartisan effort to address this epidemic. I filed 2 amendments that I think will improve the bill. I hope to see them in the manager's package. The first amendment would just simply expand the efforts that we've already made in a bill that Senator Stabenow and I introduced a couple of years ago and got a huge, a significant pilot project in that Excellence in Mental Health Act. What that does is provide 24-hour access for people living with behavioral health issues, with mental health issues, and that would include substance abuse disorder. Excellence in Mental Health creates a demonstration program that really just simply, in the right kind of facilities, requires that mental health is dealt with like all other health, that behavioral health is dealt with like all other health. When we started that debate, there was a belief that no more than 20 states would implement excellence in mental health if every state in the country was allowed to do it if they wanted to. We now have 24 states who have applied to be one of the 8 state pilots. The administration said, why don't we increase the 8 states to 14 states? We have an amendment to this bill that would say, let's go ahead and increase the 14 states to all 24 states. Because not only is this the right thing to do, but what these states will find out is when you deal with mental health like all other health, you probably save money because the other health issues that people with behavioral health issues have are so much more easily dealt with. It's been long said that we have really turned over in an outrageous way the mental health obligations of our society to the local police department and the emergency room. That is no way to do this. It is no way to solve this problem. We are about 50 years behind, and we're beginning now to catch up in the ways we should. I also filed an amendment to authorize the Department of Health and Human Services to use telehealth to allow this program to work more effectively, to allow telehealth to be one of the specifically reimbursable opportunities here. According to the Center for Disease Control, individuals in rural communities are more likely, not as likely, not less likely, are more likely to overdose on prescription painkillers than people in the cities, people in urban areas. In fact, death rates from overdoses in rural areas now greatly outpace the rate in large metropolitan areas, which historically had higher rates. So what do you do to connect those individuals with the kind of help they might need on a basis that they can turn to that help when they need to? One way to do that certainly is telehealth treatment options. Telehealth allows individuals in rural or medically underserved areas, many of whom just simply don't have other treatment options, to receive the care they need, to receive the attention their issue needs remotely. Additionally, telehealth can be an important component in ensuring that those patients receiving treatment from pain management use opioids effectively and appropriately and don't get started down the wrong path in the wrong way. July 2014, the Journal of the American Medical Association published a study that followed patients who reported moderate to intense chronic musculoskeletal pain of the 250 patients in the study have received the normal standard of care and have received a year of telephone monitoring in addition to normal care. Patients who were monitored via telehealth were twice as likely to report less pain after 12 months. Having somebody to talk to, being able to ask a question about whether you should increase the medicine because your pain is worse that day. Researchers have clearly noted that fewer telehealth patients started taking or escalating doses of opioids than people who were simply taking medicine on their own. Telehealth holds promise in lots of areas. I believe this happens to be one of them. As chairman of the Labor, Health and Human Services Appropriation Subcommittee, I was proud to see us increase funding, a 284% increase, and I'll say again, we did that by cutting funding in other areas. One of the things the government has to start doing is to truly prioritize. If everything's a priority, nothing is a priority. Today, with this piece of legislation, the Senate's telling our friends on the other side of the Capitol and around the country that this is an epidemic we intend to deal with. I look forward to the continuation of this debate, the end of this debate, and passing this bill.